Welcome back to the channel. Today we are tackling one of the most avoided, most whispered about, and most wildly misunderstood topics in senior health: masturbation in older adulthood. And before you scroll away, let me be completely honest with you. This is not a video designed to embarrass anyone. This is a medical discussion. The kind your doctor probably should have had with you years ago but never did, because the medical system frankly does a terrible job of addressing sexual health in people over 60. Here is the reality. Millions of older adults across the United States engage in self-stimulation on a regular basis. Studies from institutions like the New England Journal of Medicine, Harvard Medical School, and the University of Chicago confirm this. Yet the shame surrounding the subject keeps people silent, and that silence has real health consequences. People make decisions based on myths they absorbed in childhood. They avoid conversations that could prevent serious complications. They deny themselves something that, according to a significant body of clinical research, may actually be protective for both the body and the mind. So today, we are going to walk through the genuine medical facts, demolish the most stubborn myths, talk about real benefits, flag the actual risks that do exist, and give you practical guidance you can trust. No judgment, no awkwardness, just evidence. Let's begin. Section 1. Why nobody talks about this after 60 to 105. There is an unspoken rule in our culture, and it goes something like this. Once your hair turns gray, society assumes your body just shuts that department down. Sexual desire? Gone. Physical pleasure? Irrelevant. Self-touch? Somehow inappropriate. Except the body did not get that memo. Not even close. A landmark study published in the New England Journal of Medicine surveyed over 3,000 adults between the ages of 57 and 85. The findings were striking. Among men aged 65 to 74, roughly 53% reported masturbating within the previous 12 months. Among women in the same bracket, the number was around 22%. And researchers openly acknowledged that female numbers were likely underreported due to generational stigma. Think about that. More than half the men in that age range and a significant percentage of women are engaging in this behavior, yet almost none of them are discussing it with their physicians. The silence creates a vacuum, and myths rush in to fill it. Many seniors grew up in households where self-pleasure was framed as sinful, dangerous, or a sign of mental weakness. Some were told it would cause blindness. Others heard it would sap their physical strength, shrivel their organs, or invite disease. Those messages were delivered by parents, clergy, school teachers, and even doctors, authority figures whose words carried enormous weight. And those words didn't just disappear when the calendar flipped to 2026. They calcified. They became part of the architecture of belief. So the first thing we need to do, before we examine a single study, is acknowledge something simple. If you have carried guilt or confusion about this subject for decades, you are not alone. You are not unusual. And you are not broken. You are a product of the information you were given. And today, we are going to update that information with what medicine actually knows. Myth number 1. Masturbation causes physical weakness and fatigue in older adults. This is one of the oldest myths in human history, and it has zero clinical support. The amount of energy expended during self-stimulation is roughly comparable to climbing a single flight of stairs at a moderate pace. Your heart rate elevates briefly, certain muscle groups contract, and then the body returns to baseline. There is no mechanism by which this would produce systemic weakness. In fact, the hormonal cascade that follows orgasm, including the release of oxytocin, endorphins, and prolactin, tends to promote relaxation and muscular recovery. If anything, the body enters a brief restorative state afterward. For older adults concerned about fatigue, the culprit is far more likely to be poor sleep quality, medication side effects, nutritional gaps, or unmanaged chronic conditions like hypothyroidism or anemia. Blaming self-pleasure for tiredness is medically comparable to blaming a 5-minute walk for exhaustion. The math simply does not work. Myth number 2. It drains testosterone in older men. This myth persists because it sounds vaguely scientific, Testosterone is linked to virility, virility is linked to ejaculation, so ejaculation must deplete testosterone, right? Wrong. Research published in the Archives of Sexual Behavior and replicated across multiple clinical settings shows that testosterone levels experience a negligible, temporary fluctuation following orgasm and return to baseline within a very short window. Chronic masturbation does not lower your resting testosterone levels, aging does, obesity does, sedentary lifestyle does, sleep deprivation does, but the act of self-stimulation does not meaningfully alter your hormonal profile. If you are an older man experiencing genuine symptoms of low testosterone, persistent fatigue, loss of muscle mass, depressed mood, reduced libido, those symptoms deserve a blood panel and a conversation with an endocrinologist. They do not deserve to be attributed to a normal sexual behavior. Myth number 3. Masturbation causes or worsens prostate cancer. This one is particularly important because it terrorizes older men into avoidance, and the research tells a very different story. A major prospective study conducted by Harvard's T.H. Chan School of Public Health followed nearly 32,000 men over 18 years. The results, published in European Urology in 2016, found that men who ejaculated 21 or more times per month had a roughly 33% lower risk of developing prostate cancer compared to men who ejaculated 4 to 7 times per month. 33%. That is not a trivial number. Now, and this is important, correlation is not causation. Researchers are careful to note that more studies are needed and that ejaculation frequency is just one factor in a complex disease picture. But the direction of the evidence is clear. Ejaculation does not appear to increase prostate cancer risk. If anything, the data leans protective. Myth number 4. It is psychologically harmful or a sign of loneliness. Many seniors who are widowed, divorced, or living alone feel ashamed when they experience sexual desire, as though wanting physical pleasure after the loss of a partner is somehow disrespectful or pathetic. Clinical psychologists and geriatric specialists push back against this framing aggressively. Sexual desire is a neurobiological function. It does not expire with grief. It does not require a partner to be valid. And engaging with one's own body is not a symptom of loneliness. It is a form of self-care, bodily autonomy, and emotional regulation. Dr. Michael Perelman, a clinical professor of psychiatry and reproductive medicine at Weill Cornell Medical College, has written extensively about the importance of destigmatizing solo sexual behavior in aging populations. His position, shared by many in geriatric medicine, is straightforward. Denying older adults the right to a healthy relationship with their own bodies creates more psychological harm than any amount of self-pleasure ever could. Myth number 5. Women over 60 don't do this, or shouldn't. Let's put this one to rest permanently. The National Survey of Sexual Health and Behavior, one of the largest studies of its kind, found that women continue to engage in self-stimulation well into their 70s, 80s, and beyond. The rates are lower than those reported by men, but researchers consistently attribute this gap to reporting bias rather than actual behavioral difference. Women of the baby boomer generation and earlier were subjected to even more intense cultural suppression around the topic of female self-pleasure than their male counterparts. The physiological benefits for older women are well documented. Self-stimulation promotes blood flow to vaginal and clitoral tissue, helps maintain elasticity, can reduce symptoms of vaginal atrophy associated with menopause, and triggers the same beneficial hormonal responses, oxytocin, endorphins, dopamine, that benefit men. Gynecologists specializing in menopause care increasingly encourage patients to maintain sexual activity, including solo activity, as a component of pelvic health. Section 3. The Real Medical Benefits, 1030-16. Now that we have cleared the wreckage of decades of misinformation, let's talk about what the science actually supports, because the list of genuine, clinically observed benefits is longer than most people expect. Benefit 1. Improved sleep quality. Insomnia and disrupted sleep plague the senior population. Roughly half of adults over 65 report some form of chronic sleep difficulty. Following orgasm, the body releases a surge of prolactin and oxytocin while simultaneously reducing cortisol. This biochemical shift promotes drowsiness and deep relaxation. Multiple sleep researchers have noted that orgasm, whether partnered or solo, functions as a natural sedative with none of the dependency risks associated with pharmaceutical sleep aids like zolpidem or benzodiazepines. For an older adult lying awake at midnight, reaching for their own body may be safer and more effective than reaching for a pill bottle. Benefit 2. Pain reduction. Endorphins released during sexual arousal and orgasm function as the body's own analgesic system. Studies have demonstrated measurable increases in pain tolerance following orgasm, with effects lasting anywhere from several minutes to over an hour depending on the individual. For seniors managing chronic pain conditions, arthritis, neuropathy, lower back degeneration, fibromyalgia, this represents a genuine, drug-free avenue of relief. It is not a replacement for medical treatment, but it is a complement that costs nothing and carries virtually no side effects. Benefit 3. Cardiovascular conditioning. The brief elevation in heart rate and blood pressure during sexual arousal mimics mild cardiovascular exercise. For older adults whose mobility is limited, perhaps due to joint problems, balance concerns, or recovery from surgery, this gentle cardiac stimulus provides value. A 2015 study published in the American Journal of Cardiology found that regular sexual activity was associated with reduced cardiovascular event risk in older men. The mechanism is straightforward. The heart, like any muscle, benefits from periodic exertion within safe limits. And here is something worth saying directly. If you are over 60 or if you are caring for someone who is, this information could change how you approach daily health. It could ease decades of unnecessary guilt. Share this video with someone who needs to hear it. You might be surprised how many people in your life have been carrying these same questions in silence. Benefit 4. Pelvic floor maintenance. This benefit is especially critical for women but applies to men as well. The pelvic floor muscles contract rhythmically during orgasm, effectively performing a targeted strengthening exercise. Strong pelvic floor muscles support bladder control, bowel function, and sexual responsiveness. Urinary incontinence affects approximately 1 in 3 older women and 1 in 8 older men, and pelvic floor weakness is a primary contributing factor. Orgasm, whether achieved through self-stimulation or partnered activity, directly engages these muscles in a way that parallels structured Kegel exercises. Benefit 5. Cognitive stimulation and mood regulation. Orgasm activates multiple brain regions simultaneously: the prefrontal cortex, the limbic system, the hypothalamus, the cerebellum. Functional MRI studies have demonstrated that sexual climax produces one of the most comprehensive patterns of neural activation achievable through any single activity. For an aging brain, this kind of broad-spectrum stimulation has potential neuroprotective value. Additionally, the dopamine and serotonin released during arousal and orgasm directly counteract the neurochemistry of depression and anxiety, two conditions that disproportionately affect isolated older adults. Benefit 6. Prostate health in men. We covered the cancer data earlier, but the benefits extend beyond malignancy risk. Regular ejaculation helps flush the prostatic ducts, potentially reducing the buildup of seminal fluid and cellular debris that can contribute to inflammation and benign prostatic hyperplasia symptoms. Some urologists informally refer to this as prostate hygiene. And while the term is not a formal clinical designation, the underlying principle is grounded in basic physiology. No honest medical discussion pretends that any behavior is entirely without nuance, so let's address the areas where genuine caution is warranted: skin sensitivity and lubrication. Aging skin produces less natural oil and moisture. Mucosal tissue in the genital region becomes thinner and more fragile, particularly in postmenopausal women. Friction without adequate lubrication can cause micro tears, irritation, and discomfort. The solution is simple and carries no stigma. Use a high-quality water-based personal lubricant. They are available at every pharmacy in America, and purchasing one is no different from buying hand lotion. If irritation persists despite lubrication, mention it to your doctor. Persistent genital skin issues can occasionally signal underlying conditions like lichen sclerosis or fungal infection that deserve clinical attention. Cardiovascular considerations. For the vast majority of older adults, the cardiac demand of self-stimulation falls well within safe limits. However, if you have a history of unstable angina, recent myocardial infarction within the past 2 weeks, uncontrolled hypertension above 180/110, or severe aortic stenosis, the American Heart Association recommends discussing sexual activity, all forms including solo, with your cardiologist before proceeding. This is not alarmist. This is the same guidance given for activities like shoveling snow or climbing multiple flights of stairs. Compulsive patterns. For a small percentage of individuals, any pleasurable behavior can become compulsive. Eating, shopping, gambling, sexual activity. If masturbation begins interfering with daily responsibilities, causing physical injury through excessive frequency, or serving as the sole coping mechanism for emotional distress to the exclusion of all other outlets, that pattern warrants a conversation with a mental health professional. This is not about the behavior being inherently dangerous. This is about recognizing when any behavior has shifted from healthy engagement to compulsive avoidance of underlying issues. Medication interactions with sexual function. Many medications commonly prescribed to older adults affect sexual response. SSRIs, beta blockers, antihistamines, certain blood pressure medications, and opioid painkillers can all diminish arousal, delay orgasm, or reduce sensation. If you notice that self-stimulation has become significantly less pleasurable or more difficult, the medication profile is the first place to investigate. Speak with your prescribing physician. Dosage adjustments or alternative medications often resolve the issue without requiring you to sacrifice either your medical treatment or your sexual well-being. Hygiene fundamentals. Clean hands before and after. Clean any devices or aids used. This is basic infection prevention, particularly important for older adults whose immune response may be slower and whose skin barrier may be compromised. Urinary tract infections in seniors can escalate rapidly and sometimes lead to hospitalization. A simple hand-washing habit before intimate self-contact reduces that risk substantially. So, pulling everything together, what does a healthy, guilt-free, medically informed approach actually look like for someone over 60? First, release the shame. Whatever you were told as a child or young adult about this topic was almost certainly not grounded in medical evidence. You have permission from science, from your own body, from basic human dignity to experience pleasure without apology. Second, listen to your body's signals. Arousal patterns change with age. Erections may take longer to develop and may be less firm. Vaginal lubrication may decrease. Orgasm may feel different than it did at 30. None of these changes mean something is wrong. They mean your body is aging, which it has been doing every single day of your life. Adaptation is natural. Patience with yourself is essential. Third, keep lubricant accessible. Treat it like a bathroom staple. Silicone-based formulas last longer. Water-based formulas are gentler on sensitive tissue and compatible with all device materials. Avoid products containing glycerin, parabens, or fragrances if you have reactive skin. Fourth, consider the timing. If you find that sexual activity helps you sleep, engage in the evening. If it energizes you, morning might serve you better. If you manage a cardiac condition, avoid combining sexual activity with heavy meals, alcohol, or extreme temperature environments, as these multiply cardiac demand. Fifth, talk to your doctor if something changes. A sudden loss of sensation, persistent pain during arousal, unusual discharge, or blood in semen or vaginal fluid are all signals that deserve professional evaluation. These symptoms do not necessarily indicate anything sinister, but they should never be ignored out of embarrassment. Any physician worth their degree will respond to these concerns with clinical neutrality and appropriate investigation. Sixth, If you have a partner, consider having the conversation. Many couples over 60 maintain active solo sexual lives alongside their partnered intimacy. And research from the Kinsey Institute suggests that openness about self pleasure within a relationship is associated with higher overall sexual satisfaction for both partners. The conversation may feel vulnerable, but vulnerability between long term partners tends to deepen connection rather than threaten it. Let me bring us back to where we started. That 72-year-old man lying awake at 3 in the morning, wondering if he is hurting himself, wondering if something is wrong with him, wondering if the guilt he has carried since adolescence was justified all along. The answer, according to the weight of modern medical evidence, is no. Nothing is wrong with him. Nothing was ever wrong with him. His body works. His desire is intact. And the behavior he has been quietly agonizing over is, for the overwhelming majority of older adults, not only harmless but actively beneficial. For his prostate, his heart, his sleep, his mood, his pelvic floor, and his fundamental sense of bodily autonomy. You deserve accurate information. You deserve to make decisions about your own body based on evidence rather than inherited shame. And you deserve to enjoy the years you have, all of them, fully in every dimension of what it means to be a living, feeling human being. That is not a radical statement. That is basic medicine. If this video gave you something useful today, clarity, relief, permission, even just a single fact you didn't have before, subscribe to the channel. We publish new senior health content every week, covering the topics your doctor probably isn't bringing up. Hit the bell icon so you never miss an upload. Share this video with a friend, a sibling, a parent, or a partner who might be carrying the same silent questions. And drop a comment below telling us what health topic you want us to tackle next. Your health, your body, your life. Nobody else gets to define what those mean for you. Take good care of yourselves. We will see you in the next one.